Welcome everyone. We're going to get started right at noon, so let everyone get settled in. Please remember to take our pre-session survey while you wait for the session to begin. There's a link right in the chat for that survey if you haven't taken that already. Go ahead and do that now while we're waiting. Going to get started right at noon. As everyone's getting signed in and settled, make sure you take our survey. The link is there in the chat. It's for our pre-session survey. That'll be closing shortly into the webinar, so we'll get started right at 12 noon. All right, we have 12 noon. Good afternoon, everyone, and welcome to today's MicroLearn session, Session 2, Draining Wound. This is part 2 of a 5-part MicroLearn series brought to you by Project Firstline, Rhode Island, under the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health in partnership with the CDC. And if you haven't already, go ahead and take our pre-session survey. My colleague Abby Anderson, the Project Firstline Rhode Island project assistant, is behind the scenes along with the entire team in support of this session. This will be a 15-minute MicroLearn session. Feel free to enter any questions you have into the Q&A box, and we can take some time at the end to answer any questions. And you can also email us anytime. My name is Stephanie Doyle. I'm an infection prevention training liaison for Project Firstline Rhode Island, and a community public health nurse at the Center for Acute Infectious Disease Epidemiology at the Rhode Island Department of Health. I'll be your host and presenter for today's session. So today we're going to talk about what you should do if you see a patient with a draining wound. And as I mentioned, this is part of a MicroLearn series. And Abby is now going to share the link to all of the MicroLearn materials so you can review them and hopefully utilize them in your facilities. If you want to take a minute, go ahead and introduce yourselves in the chat box. Tell us where you're coming in from. So glad to meet everyone. If you're returning, glad to see you again. So we have the chat box available. You can enter any questions in there in your email if you'd like to be added to our distribution list. So this is a brief overview of the MicroLearn process. So before presenting a MicroLearn, check with the policies and protocols at your facility and adapt the content accordingly. Excuse me. Incorporate MicroLearns into existing opportunities where groups of healthcare workers gather, such as pre-shift huddles or team meetings. So you want to gather your team to make sure they have a good understanding on how to safely take care of a patient with a draining wound as a learning opportunity for all of the staff to gather and let you know their understanding, and you can present this topic to them to let them know what you expect from them while taking care of patients and in the facility, and to keep everyone safe and keep infections from spreading. The session should be led or facilitated by an experienced team member with infection control expertise. The MicroLearns reinforce infection control concepts when risks are observed in patients or in the patient environment. If during the MicroLearn a team member witnesses a patient in distress, such as shortness of breath or bleeding, they should respond to the emergency per facility protocols. So on our agenda for today, we've done our welcome and introductions. We'll go over learning objectives for today's session. We're going to identify draining wounds and risks involved in caring for wounds. We'll talk about what should healthcare personnel do when caring for a patient with a draining wound. We'll have a discussion. We'll have some announcements at the end, and we'll ask for your feedback with a brief end of session poll. So at the end of today's session, you should be able to identify characteristics of draining wounds and be aware that wounds are reservoirs where germs live. Recognize that germs such as HIV, MRSA, CRPA, Group A strep, Hep B, and hepatitis C can spread by blood and body fluids. And while caring for a draining wound, understand and implement infection control actions such as hand hygiene, gown and glove use to keep your patient or resident and yourself safe. And be able to use resources to safely implement facility policy and evidence-based practice when caring for a patient or resident with a draining wound. So another brief note about the microlearns. The Project Firstline Infection Control microlearns are a series of guided infection control discussions that provide brief, on-the-job educational opportunities. Each microlearn focuses on a single infection control topic and connects infection control concepts to immediate practical value. Healthcare workers can easily apply the key points to their daily work and perform the recommended actions to keep germs from spreading. The microlearns can be incorporated into existing opportunities where groups of healthcare workers gather, such as pre-shift huddles or team meetings. And the sessions should be led by and facilitated by an experienced team member with infection control expertise. So each microlearn contains a discussion guide and a job aid. And these can be used during the microlearn session and after. Post them at the nurse's station or in places where people congregate for a quick reference on how to care for a patient or resident with a draining wound. So now we'll get into the microlearn topic. So we're going to introduce the topic of wounds to the team. So a draining wound is a break in the skin or other tissue that has liquid coming out of it. So keep it very simple. A draining wound is a warm, wet place where germs grow easily. And a draining wound is also a vulnerable spot on the patient that should be handled carefully, both to keep germs from spreading and to protect the patient from germs. And now we're going to expand the topic of wounds. So always assume the liquid in a draining wound is infectious. If you have to touch anywhere near the wound or anything that could have been contaminated by liquid from the wound, clean your hands and use gloves. And always clean your hands as soon as you take off your gloves. Depending on the situation, you might need other personal protective equipment or PPE, like a gown or eye protection to protect yourself. It's often best to cover the wound to contain the drainage and protect the open tissue. In rare cases, however, wounds should not be covered, so make sure you consult with your clinician on what they would like you to do with a draining wound in your facility. If you have to touch anywhere near the wound or anywhere that could have been contaminated from the liquid from the wound, clean your hands and use gloves. So you also want to reinforce that draining wounds can be caused by or contain germs that spread easily by touch, like MRSA or Group A strep. Germs commonly found in stool that are often found on the skin, like Klebsiella and VRE, and germs that spread by blood and bodily fluids like HIV, hepatitis B, and hepatitis C. So these resources are from the CDC, and it's just a reminder, where germs live. Germs live on the skin, germs live in the gut, and germs live in the blood. And these can also be distributed to your staff during the microlearn or placed in a common area such as the nurse's station for continued education, just reminders of where germs live and how they can be transmitted to others. So your microlearn continues with a discussion. So you want to bring your team together to discuss what was learned in the microlearn session. You want to find out how your team feels about the topic. Abby just shared the resources for the skin, the gut, and the blood, where germs live, in the chat there. So on to discussion. You want to find out how your team feels about the topic. So you can ask them questions, have you ever dealt with a draining wound before, and how have you dealt with it? So you can ask them what they usually do when they see a draining wound. And then you could tell them what you do when you see a draining wound. Of course, you check your facility policy and procedure. And what I would do is assess the situation, make sure everyone is safe, gather as much information and supplies as needed before entering the scene, perform hand hygiene and don appropriate PPE, and attempt to contain the drainage, activate environmental services personnel, and communicate anything that needs to be communicated to them so they can safely clean and disinfect the environment after the drainage is contained. Some other questions that you might want to ask during the discussion portion of the microlearn is how can you safely protect yourself and the patient when you see a draining wound? Answers could be, using standard precautions and proper communication with the entire team on what's expected. And when might you call for help or assistance when you're dealing with a patient or resident with a draining wound? So an answer that you could provide is that if you are unable to safely contain the drainage and the scene is not safe, that's when you would call for assistance, or you're not completely sure what to do in the situation. Make sure you have all the tools and resources available that you can call for assistance if needed. And then bring the team together, and as a team, how can we help each other to take the right infection control actions when we see a draining wound to keep germs from spreading? And you can also, at this time during the microlearn, share a case scenario and how you approached a patient or resident with a draining wound and following your policies, procedures, physician's orders, and make sure everyone knows where the supplies are kept and make sure they are available and accessible to all the staff so they can safely care for the patient and prevent the germs from spreading. And at the end of the microlearn, you want to wrap up and reinforce. At this point, you can share facility-specific information and cue to follow-up opportunities, connect the content with information such as whom to contact about wound care, relevant facility policies such as where to find PPE and supplies, recent cases or examples of patients with draining wounds, or other relevant information. So for our key takeaways, you want to assess which infection control actions you can take when approaching a patient with a draining wound, consider any drainage from a wound infectious, use infection control considerations when handling potentially infectious materials, and keep yourself and coworkers accountable and empower the patient to do the same. Here are our references for today's microlearn session. And if you have some time, please take our end of session feedback poll. We have a couple minutes left, so go ahead and take that just 3-question poll. And this will help us improve our future training sessions to suit your learning needs. So if anything comes up, feel free to email us. I want to thank everyone for coming. And please join us Thursday, same time, same place, for our microlearn on blood. That will be hosted and presented by my colleague, Jacob Peguero. Again, that's Thursday, and Abby can share a link to sign up for the future microlearn sessions. And we have 2 more the last week of September as well, presented by my colleague, Lisa Ledoux, on cough and congestion and diarrhea. So make sure you sign up for those sessions as well. And again, thank you everyone for joining us today, and hope to see you on Thursday and for future sessions. Again, thanks so much and have a great day.